posture-modifying devices can be effective, but you need nothing more than a step stool. So if you have kids or grandkids and they have a step stool to get them up so they can brush their teeth, you do not have to waste extra money on a $30 piece of plastic that's made in China for 1.1 cents on the dollar. Okay? Stools will do the same. The key is this: your knees must be above your hips. You want your body extended with your elbows on your knees. Lots of people, when they push to go to the bathroom, do this. And they tighten up and can't breathe. No, you want to bellow out the belly. You want to push your abdomen out like it's a bellow to relax the pelvic floor. You want to tell people to try and do this at certain times of the day. First thing in the morning and after meals, because your body has all kinds of different secretory enzymes that lead to increased propulsion and contraction of the colon. First thing in the morning, which is why the cup of coffee helps as well, and after meals. So I see these patients all the time that come in and say, I'm not eating anymore because it doesn't go anywhere, and the amount going in is not equal to the amount coming out. Now, the first thing that goes through my mind is, how are you quantifying that? Okay, because that's not how it works. But I get what they're saying, and then I tell them, you have to eat something because it's the eating that's the stimulus or the driving force to go into the bathroom, so you're doing yourself a disservice. But you do not have to spend 8, 12 hours on the toilet a day. Override the urge, 5, 10 minutes, get up, move on with your life, okay? Do these posture-modifying devices work? Yes. This is a nice study from Michigan. The most important test that we can do when we test the pelvic floor muscles is what we call a balloon expulsion test. If this is on primary care boards, if they're going to ask you anything about the pelvic floor and they ask, you think somebody has a pelvic floor problem, what's the test you run? It's the balloon expulsion test. So what they did, my friends at Michigan did, is that they did a study where they took all their patients, they did the balloon expulsion test. If the patient couldn't pass the balloon in 2 minutes, they put them on a posture-modifying device and they did the test again. And 1 out of every 6 individuals that couldn't pass the balloon the first time could then pass the balloon. No training, no laxatives, no education, nothing. Just, did you pass the balloon on the toilet? Nope. Here, stick the step stool under your legs. Can you pass the balloon now? Yes. So posture matters, and it's a very simple thing to do for your